Why do some kids get anaphylaxis from unusual triggers? Imagine a child eating a snack and suddenly having a severe allergic reaction that can be life-threatening. While many kids react to common foods like peanuts or milk, some react to much less expected things. This is because anaphylaxis can be triggered by a wide range of substances, not just the usual suspects. In children, the most common triggers are well-known allergens like nuts, eggs, shellfish, or insect stings. But sometimes, children experience anaphylaxis from unusual triggers that are not typically associated with severe reactions. The reason some children react to these rare triggers lies in how their immune system recognizes and responds to substances. Usually, allergies happen when the immune system mistakenly sees a harmless substance as a danger and reacts strongly. For most kids, this response is triggered by common allergens. But in some children, their immune system can overreact to less common things, like certain food additives, spices such as fenugreek, or inactive ingredients in medicines called excipients. These substances are not usually considered major allergens, but in sensitive children, they can cause a severe allergic reaction. Sometimes, these unusual triggers are overlooked during initial medical evaluations. This can lead to a diagnosis called idiopathic anaphylaxis, which means no clear cause is found. Other rare causes include reactions to parasites like Anaphylaxis, which can be found in raw or undercooked fish. In some cases, children might experience reactions when they eat a certain food and then exercise afterward, which is called food-dependent exercise-induced anaphylaxis. These complex reactions can make diagnosis more difficult because they happen in specific situations or after a delay. Children may be more prone to reacting to unusual triggers because their immune systems are still developing and may respond differently than adults. Some children also have a genetic tendency toward allergies or asthma, which can increase their risk of severe reactions. Recognizing these rare triggers is very important for proper diagnosis and treatment. Doctors often take a detailed medical history, asking about diet, medications, and recent exposures to help find the cause. Sometimes, specialized tests are needed to confirm what caused the reaction. In summary, some children get anaphylaxis from unusual triggers because their immune systems can react strongly to substances that are not normally considered allergens. These reactions can be tricky to identify but are very important to recognize so that children can avoid future exposures and get the right care. If a child has experienced a severe allergic reaction, it is always best to consult a healthcare professional who can help determine the cause and develop a safe plan to prevent future reactions.